You all know that these webinars are academically we started in the COVID era. We are highly obliged, Dr. Nabia. You also participated in our previous 4 or 5 webinars, especially related to the gynecology. We tried our best to introduce this cervical cancer day, but unfortunately there were so many problems. There are so many issues, so that this webinar was being postponed many times. But today, highly obliged to Dr. Gul and Madam, we are also highly obliged for you for this session. Now it is over to you to start. I will request all other people to mute their mics. And after this session, there will be question answer sessions. And if there is internet problems, Dr. Shafak, you will take over these sessions. Thank you so much. Over to you, Dr. Nabia.
Thank you, Professor Bukhari. Today we are here. This is basically an awareness seminar. And this awareness, I guess every medical profession has, but we are here to talk about how to communicate this message to the community. So talking about eliminating cervical cancer, how we can go through it and how we can help our nation to eliminate this from our community. There are some big facts about the cervical cancer. It is the 4th most common cancer in women worldwide and 2nd most cause of death in female genital cancers. There are different interventions and health behaviors that can help to prevent the cervical cancer. This is the only cancer which can be prevented. Mostly cancers can be detected early by screening and then managed, but this is the one which you can prevent from happening. This is the main thing about this cancer, and this is why we want to spread this message to our community that this is the only preventable cancer. Let's join hands together to prevent this cancer from our community. So therefore, early detection can also help in, if you are in the screening and you detect the early, that will also help in reducing the morbidity and mortality. Otherwise, if you don't screen, if you don't protect your community from it, this is a lethal cancer, and very soon it's going to take the life of the women. There are few facts about this cancer. Cervical, we are talking only about the cervical cancer, which is in the cervix, not about the uterine body, fundus, and endometrium. So the cancer of the cervix in 2020, according to 2020 census, it was 600,000 women who were diagnosed with cervical cancer worldwide. And out of these, 342,000 women lost their life from this. And the problem, main issue is that this was a preventable disease from which we lost 342,000 women in a year worldwide, globally. What about Pakistan? In Pakistan, according to 2020 census, an estimated cervical cancer incidence is 6.1 per 100,000 women, and 4,000 deaths were recorded. And this may be tip of the iceberg, because we know we don't have a good reporting system here. We don't know women dying in the north or in the deserts of Sindh or in Azad Kashmir up in the mountains, how they had a problem and how they died, why they died. We don't know the reason. So according to the government estimated figures, this was 6.1 per 100,000 women in 2020. And WHO has estimated that by 2030, about 500,000 women worldwide will die from the cervical cancer. And important thing about this is that 95% of deaths will occur in low and middle income countries. It is not the affluent countries or in high income group. It is the low and middle income countries where 95% deaths will take place by 2030. It is estimated that about 500,000 deaths. So what is this? This is due to a persistent infection with high risk HPV. high-risk human papilloma virus, which is through sexual transmission. Human papilloma virus, there are more than 150 strains of human papilloma virus diagnosed up till now, but it is the only few high-risk strains, around 9 to 10 strains, which are responsible for cervical cancer, and this is only through sexual transmission. It is not through by other means. So the important risk factor about this cancer is there is an early onset of sexual activity, and multiple sexual partners are responsible for spread of this infection, leading to cervical cancer. Early onset of sexual activity and multiple sexual partners. Added with this, if a woman is immunocompromised, like she has HIV, or she is a renal transplant patient, or she is on immunosuppressive therapy for any other reason, she is more at risk. Once she will have HPV infection, it will be difficult for her to eradicate this infection from her body. And so the infection will persist in her body, will lead to changes in the cervix, which will lead later on to the cervical cancer. It is also related to cigarette smokers, more in cigarette smokers, because in cigarette smoking, HPV clearance from the circulation is delayed, thereby resulting in more persistent changes in the cervix. Low income class, maybe indirectly, it is again low immunity, hygiene, and these things are related with the persistence of HPV in their circulation. So what are the symptoms of this disease? This is basically women can notice abnormal vaginal discharge. The most important symptom is irregular vaginal bleeding, especially it is not related with the cycles. It can be intermenstrual bleeding, or the bleeding can be immediately postcoital. After sexual relationship, she can notice vaginal bleeding, or in between the cycles, she can have irregular spotting, discharge, or other things. Once it is advanced, once there is a proper cancer in her body, then she can have symptoms related to that growth where it spreads. If it is spreading interiorly, she will be having urinary symptoms, posteriorly bowel symptoms, pain involving the parametrial tissue, ureters, all leading to kidney failure, and all these things will be linked with advanced stage disease. So WHO has planned to eradicate this disease by 2030. And WHO websites are full of these materials, how we can eradicate. The first step is vaccination against HPV. Second is screening for cervical cancer. And third, if a woman has been diagnosed with cervical cancer, she needs to have a good management in a proper cancer related center. Facilities should be there. They are able to handle cervical cancer, because cervical cancer is not like other ordinary cancer. We need special radiation, brachytherapy, and other means, proper urogynecological setup for the surgery as well. So talking about primary prevention, primary prevention is through vaccine, because this is a virus and there is a vaccine against this virus. And this vaccine was introduced in 2007, and from 2000 onward, this was available in national health programs of different countries. And this was targeting 12 to 14 years old girls, school girls, for which the vaccine was offered. And then initially it was a bivalent working against only 2 strains. Then the quadrivalent working against 4 strains came up. And now these days we have nanovalent vaccine, which targets against the 9 HPV high-risk strains. So making this vaccination 100% effective. Unfortunately, this vaccine was available in Pakistan before COVID time, around 2012, 2015, this was available. But now these days, this is not available in Pakistan, unfortunately. However, the Ministry of Health is trying hard to get this vaccine and to link this with EPI program. So we are expecting that by 2025, this vaccine will be included in EPI program, where this will be offered to 9 to 14 years old school girls. So by 2025, once the vaccine is available, we have to disseminate this message that this vaccine is important and you have to take up this vaccine. Once we were talking about this vaccine with our doctors and um, other health professionals, so we came to know that even in UK and Ireland, our doctors did not allow their girls to get this vaccine because they thought this is not our problem. This is related to sexual behavior, and maybe we as a Muslim society, we don't need this vaccine. But unfortunately, this virus can be contracted by sexual intercourse. It's not important that whatever sexual behavior, still you are at risk of having this viral infection and getting CS cervix. So it's important that people should understand, the girls and their parents should understand the significance of this vaccine, and they should be able to take up this vaccine once this is available in EPI program free of cost. This vaccine is, if we talk about nanovalent vaccine, this is will be in 2 doses, 0 and from 6 to 12 months second dose, and 9 to 14 will need only 2 doses. If you have to give it to more than 15 years old, then 3 doses are required. And because HPV also causes male infections as well, and the male anorectal cancers are also responsible uh, for HPV infection. So the males can also be offered vaccine, but the currently only the female girls from 9 to 14, they are offered free vaccine, and the rest have to buy, and then they can decide themselves. WHO has issued the screening guidelines. WHO has basically taken up it as a public health emergency, and has issued the guidelines how we can eliminate this cancer from our community. Talking about primary prevention, we talked about the vaccine. We talked about the vaccine is not available in Pakistan. We talked about that we have to disseminate this important information to the parents. We have to communicate it to the community that this is, once this vaccine is available, this is important and you have to take up this vaccine. Talking about secondary prevention is regarding subjecting all the healthy population to a test, which are the screening test. Once these screening tests are subjected to all the population, healthy population, you will be able to pick up HPV virus from the smears and smear testing. Cytological changes in the cervix can be found, which are HPV related. So these are the 2 tests. Currently, HPV testing is not available in every center of Pakistan. It is, however, available in nuclear medicine hospital like Noori in Islamabad, and other centers in other cities are also there, or maybe in some of the private labs are also offering HPV testing, but this is not available in your government hospitals. And the pap smear is also usually not offered in government setups, is available everywhere in Pakistan, can be done. But unfortunately, both these screening tests, they take cost money, and this is, patient has to pay from their pocket. Patient has to pay these 2 tests, average, I think, 8 to 10,000 rupees if they want to have this screening test. However, important thing is this screening test will be repeated. If they get HPV testing today, this screening test will be repeated after 5 years. So it's worth, I think, spending 8 to 10,000 rupees after every 5 years if you want to pick up disease early. Once the HPV high risk is positive, then you can go for further diagnostic testing and you can manage accordingly, whatever is the stage. we talked about that these both screening tests are costs are not cost effective for your community, are not freely available, and these are not offered in the government setups. So there is another simple test, which is the visual inspection of acetic acid treated cervix, via. Via is basically you um, inspect the cervix and you apply 1% acetic acid to the cervix. If it is some suspicious area like high mitotic activity area or high nucleic acid content is there in the epithelium, it will turn white. So depending upon the degree of acetowhiteness, we decide that whether this woman, because this is a screening test, if we have any suspicion on screening test that this test seems there is some abnormal epithelium, then you can refer her further for smear testing, and then biopsy can be taken after colonoscopy. So this is the simple screening test via. I would request if there are any questions you can put in the chat box, because this is a totally interactive session and we want everyone to take part in this interactive session, that how these things can be done and how this is doable in our community. So please just put your any concerns, queries in the chat box. I'm constantly looking at the chat box so that we can address these things as well during the presentation. So we talked about the screening tests, that these are available in Pakistan and these can be done, although it costs money, but still these are available and people need to be aware of this. And if they make this a priority, this is not a big deal, can be done, is doable. But there are certain issues in our Asian communities that people don't go for these screening tests. They don't have that much regular uptake of screening tests as compared to the Western population. I was looking at a recent journal published in 2021 that what are the factors which really are related to the cervical screening among Asian women. So Asian women, typically, they found out that Asian culture is a bit shy culture and people don't feel comfortable going to the gynecologist without any solid reason. Once they have any problem, they have any disease, they will come to the doctor. But usually for screening tests, once they are not having any symptom or problem, they would not go to the doctor. And there can be many personal, social, cultural, and structural factors responsible for obstacles for cervical cancer screening program. So therefore, it was concluded in the article that we need to take measures to enhance the screening and should address greater utilization of screening services. If screening services are there, we have to utilize them fully. We have to ensure access is easy for everyone. We have to reduce its cost. We have to ensure a positive attitude among screening services providers. Once healthcare providers have a positive attitude, normally once the patient is pregnant and they are coming for the antenatal visits, I have heard many times that बेबी अभी क्यों आ गई, अभी तो तुम्हें कोई प्रॉब्लम नहीं है, अभी 5वें महीने में कार्ड बनेगा, फलाना होगा. तो we usually tend to discourage because we have a long queue of the patients waiting outside in our OPDs are full, and we tend to discourage women coming to the hospital. But there is an urgent need to create this positive attitude among healthcare providers if they are coming for this training, and we have to encourage women and we have to educate them. Once they know the significance of these screening tests, maybe we will be having more women coming for this program. WHO has also offered self-sampling test. You can do your self-sampling of cervical cancer, and self-sampling, taking a brush and putting it inside the vagina and just having a 360-degree rotation there in the cervix. And this test has been proven to be easy, painless, convenient, and cost effective as well, because this will save the cost of going to the hospital, paying to the doctor or person who is taking the sample. You can directly take the sample and submit it to the lab. at your own convenience. And this is again another option for the women who don't want to go to the health services. So there is a take-home message. Number one, we have to educate our community. We have to know ourselves what are the facts about cervical cancer, what is the things responsible, what are the risk factors, and how we can uh, reduce this risk, how we can eliminate this cancer, how we can prevent this cancer from happening. And we have to educate people around us. Like everyone these days has Instagram, Facebook, WhatsApp. So in all the groups, we have to educate our people who are connected to us by any means that what it is and how we can avoid this cancer from happening. We have to enforce screening, and WHO advises screening tests to be started at age of 30, because even if sexual activity starts at the age of 20, it takes 10 years for a HPV infection to cause HPV related changes in the cervix. It's a very slow growing process, and this thing makes it ideal screening test. And then get vaccinated. Once the vaccine is available, we have to prepare our community to take up good vaccine, and don't refuse this. This will be available free of cost to the school girls, but the younger girls who are still not being exposed to HPV or sexual activity, they can have on their own. Thank you so much, and I'm happy to answer any questions. Right at the moment, we don't have any questions, and I think I can invite Dr. Gulafshana here so that she will be talking about. Dr. Gulafshana is a consultant gynecologist at Maruf International Hospital, and she is, I think, one and only PhD endocrinologist, reproductive endocrinologist in Pakistan, as far as I know. She has done her PhD in reproductive endocrinology, and she has worked for 20 years in Leicester, UK, and now she has moved to Pakistan, coming back to her own roots and trying to communicate, serve the community we have here. So Dr. Gulafshana, could you please share your screen?
Assalamu alaikum. Very much kind introduction, and thank you very much for inviting me to this very important forum. As Dr. Nabia and I've been working on this cervical cancer for the past few months. Dr. Nabia, if you can share my screen, because you've got my slides. So, assalamu alaikum, everyone. As Dr. Nabia, thank you very much for inviting me, and thanks to Dr. Nabia that I'm joining this important webinar. I know that there have been a few postponements, but nevertheless, we're still doing it, and that's what's important. Yes, I'm working in Maruf International Hospital in Islamabad as a consultant obstetrician and gynecologist. And I will be repeating quite a few of a lot of the things that Dr. Nabia has already said, but it's really important that we repeatedly say these things so that it's to emphasize the point that cervical cancer is something that's preventable. It's the only cancer that's got a vaccine for it, and that's the most important thing. And most of even the doctor community, we realize, was not aware of this, because the vaccine was not available in Pakistan. Previously, it was available privately, but that was like, the people who had been abroad or whose children were abroad were aware of it, and they would buy it privately and get their girls vaccinated. But publicly, people were not aware. And then because the uptake was so low, the company just took it off the market. And that's the reason it's not available even privately now. So in 2020, WHO drafted a global strategy for elimination of cervical cancer, and it was declared a public health priority. It is a very high-risk cancer. And for us in middle and low income countries, the main problem is that because most of our population lives in rural areas, and the women present very late in the disease, very late onset cancers, and causes a lot of mortality. WHO is predicting that the mortality would rise by 27% in 2030 if nothing is done about this, cancer. The task is to eliminate this cancer by 2030. Even if we get to vaccinate and screen these women, I think it would be a high achievement. It's the fourth most common cancer, and sometimes in different studies or different papers that have come out, it's been quoted as second most common gynecological cancer in women after breast cancer. So it is very prevalent. Next slide, Dr. Nabia. And no women should die from it. It's really unfortunate that a cancer that's preventable, that can be picked up on screening, and that's got a vaccine for it, and women are still dying from it. 99% of the women are 99% of these cervical cancers in these women are caused by a virus, a human papilloma virus, and the strains that are culprit for it are 16 and 18, although there are more than 100 strains of HPV virus. And the HPV virus can cause other cancers in male population as well as penile cancers, head and neck tumors. But the ones that are implicated in cervical cancer are the strain 16 and 18 mainly. It's a sexually transmitted infection, as previously Dr. Nabia emphasized in her presentation. And 80% of the people would generate HPV at some point, but would rid of it by 2 years. But those with persistent infection would go on to develop either pre-cancer lesion of the cervix or cancer of the cervix. And as you can see, there it causes other cancers as well, including oropharyngeal cancers, penile cancers, head and neck tumors, but the leading one is the cervical cancer caused by this virus. Next slide, please. Okay, so what's the situation in Pakistan? This is when we embarked on this journey for implementing the WHO strategic goal. The only figures that we had of the prevalence of in Pakistan were by the GloboCan, which is a WHO by WHO, and it's estimated that around about 5,000 women are having cervical cancer. And this is if they're not treated or there's no screening available. 5,000 women would be affected by cervical cancer, and 5,000 would die from it, and the number would be almost doubled from what's nowadays. But the thing is that we have no cancer registry in Pakistan, and that's the most important thing. So we don't even know our own figures. Next slide, please. Yes, so Pakistan has a population of about 6 million women, which are aged between 15 years and older, who are at risk because it's a reproductive age group cancer. So 68 million women are at risk of suffering from cervical cancer. And current estimates by the GloboCan estimate there about 5,000 women are diagnosed with cancer, and more than half of them die from it. As I said, it's either third or second most important cancer that affects women between the ages of 15 and 44, or the reproductive age group. The situation in Pakistan is that we don't even know whether these figures are right or they're just the tip of the iceberg. So we don't have any national cancer registry. People are working in different pockets in the country, and Different hospitals have their own registries, but we don't have a national cancer registry. There's no, as you must have realized, there's no national HPV vaccination program available in Pakistan. And the screening with pap smear or HPV testing is very patchy. It's available at places, but it's not universally offered. And the other thing is, in places where it's offered, the women are not very keen to take it on. And then our system lacked early diagnosis and treatment. Once the cancer is diagnosed, we don't have more cancer centers where these women can be referred or treated. Next slide. Ministry of Health and Health Services Academy, together with UNFPA, embarked on this cervical for prevention of cervical, formulating the National Cancer Registry. So as part of that, we held meetings in all the provinces of Pakistan to brainstorm meetings with all the gynecologists involved. And it was very obvious that there was a dire need to have these screening programs available in Pakistan. There's dire need for the vaccination to be available, but and the ministry is very serious about it. And we've embarked on this journey, and I'm hoping that by the end of the program, so the girls aged 11 to 14 will be offered vaccination. Next slide, please. So working on the registry, as I said, at present, the Pakistan doesn't have a national cancer registry in place, and cancer registry is very essential to provide the baseline for continuous and systemic data collection, so we can know what's the prevalence in different areas where the vaccination can be prioritized. And also it would help us making strategy for the elimination of cancer. So at the minute, and we don't know our disease burden, as with any other data when we go abroad, we don't have our own data. And it's sometimes very embarrassing when we are quoting figures from organizations like donor agencies who have done some kind of studies and come up with these figures, and we don't know from where. So we have introduced an app which has been disseminated amongst the gynecologists in different provinces. So all the cancers, gynecological cancers, are with some very basic information are the data is put into that app, and at least we will have some raw data about what's the prevalence of different cancers, especially the cervical cancer in our community. So regarding vaccination, we are hoping that we will have introduced HPV vaccination program for girls, school girls aged 11 to 14 in the EPI program, and the government is trying to secure sufficient and affordable HPV vaccines. As you would know, as with any other thing, our neighboring countries like China and India have developed their own vaccine, and even countries like Indonesia, Maldives, Nigeria, Bangladesh, they have actually started with their HPV vaccination program, but Pakistan is quite behind. Next slide, please. Next slide. Is where it's available, there is good data. As Dr. Nabia said, there will be resistance against it. So that's the whole point of us campaigning at the minute. So when the vaccine is available, the parents are aware, the teachers are aware, and on top of that, the doctors are aware. Previous slide, please. That this vaccine is there, and there has been data from other countries where the vaccination program has been up and running for a number of years. So around the world, about 80 million girls and boys have been vaccinated against HPV, 280 million, 80 million only in UK, and studies have shown that it does decrease the pre-cancer lesion and cervical cancers when they studied over 11-year time period. And this result of the effectiveness of the vaccine was called Miracle of Science by the Cancer Studies Chief Executive. Next slide, please. We will have challenges, as I said. There'll be funding constraints. There'll be delays in vaccine procurement. As I said, other countries have already embarked on the vaccination programs, and we have yet to secure some funding for the vaccination. So there'll be delays in planning and rush planning, doing these advocacy via highly visible channels and creating these awareness activities at national and local levels, and also through media, going to schools, going to colleges. Social media is very powerful nowadays, and we can use that for implementation and creating awareness of this program. As with any other thing, there will be lack of coordination, but we need to have a strong political will and a very good supportive network between the doctors, the Ministry of Health, with the politicians and the school associations. The January is declared as a Cancer Awareness Month. And I think this was the first time in Pakistan that a number of activities took place for its awareness, and these are photos that were shared by our colleagues from all over Pakistan, where walks were carried on. There were symposiums, seminars, and this webinar is also a part of that campaign. A lot has been done, and we need to do it further. So what's with the screening situation, as you can see that the uptake of screening is minimal, almost minimal in Pakistan. Again, this cervical cancer is unique, not in a sense that it's preventable, it's got a vaccine for it, but also that it has a pre-cancer stage where if it's picked up through these screening tests, it can be treated. Pre-cancer stage and blown cancer is preventable. Next slide, please. So the recommendation by WHO is that at least women aged 35 should have at least one smear test in their lifetime, and then from then onwards every 5 years. So our recommendation at the minute is that any women or healthy woman by the age of 30, 35 should have at least one smear test, and then keep a record of that, and then have a smear test on 5-yearly basis. And as you can see, only 2.3% of the women are being screened at the minute. The screening tests available, as Dr. Nabia said, is the pap smear test, and then the HPV testing, and then the VIA. So there are different 3 modalities, and I would suggest that any gynecologist who can offer any of these 3 tests should recommend these tests to the women who come to see them in the clinic for any other reason, because that's the only opportunity that they can get and get them screened at least once. And if any pre-cancer lesion is picked up, then they need to be referred further for treatment of that. Next slide, please. So the issue with the treatment is that we don't have cancer centers, and the FCPS up till very recently did not have a subspecialty in gynae oncology, but we are very fortunate now that we have specially trained gynae oncologists in the country now. So Aga Khan is offering fellowships, and while I was involved in this project through HSA and Ministry of Health, we realized that in Karachi, Lahore, and even in Ahmedabad, in a Ayub Medical Complex, we have a trained gynae oncologist. Because it's when we offer these women screening tests, and if, God forbid, a precancer lesion or a cancer lesion is picked up, what to do next? So we need to put in place referral pathways, and we need to advocate and spread this information that we have these trained gynae oncologists where women can go and get adequate treatment from there. And there should be collaboration between different units. And if they are detected with pre-cancer lesion, there should be equipment available or facilities available and training available where that pre-cancer lesion can be treated there and then, so that it prevents advancement into a cancer lesion where can cause a lot of morbidity and mortality. So the way forward, we should not be working on WHO goals, but it should be our own country goal as well. That if a cancer, I think none of the other cancers are like cervical cancer, that they can be preventable. They have a vaccine against it, and they have a pre-cancer stage where they can be picked up and treated. So our main target at the minute is to have a national cancer registry, so we know our disease burden, and and it would help us determine our strategy, creating a national strategy for its prevention, screening, and treatment. And then cervical screening needs to be implemented with high coverage of women. I know it's a high task, but we have to start somewhere, and forums like yours is a very good launching pad, because we are here to tell you about this, and then I expect that you go on and spread this news or spread this own information to your students, to your fellow colleagues. And we need to also emphasize on the competency of the healthcare force, that they need to be strengthened across all three pillars, that they should be aware of why we introducing this HPV vaccination. They should have very clear-cut information about that, and where this cervical cancer screening is available and what screening is available where, whether it's the pap smear test, it's the HPV testing, or it's the VIA. And then also where the treatment facilities are available. And if we just concentrate on these three important issues, I think we will be able to achieve our target very soon. And if we just disseminate this message, I think mine and Dr. Nabia's job is half done, or more than half done. And I would encourage you to go to schools and colleges and talk about it, so they are kind of pre-programmed into this thing, so when the vaccine is available, they don't have any questions in their mind, and they're ready for the uptake of it.
Thank you so much, madam. Thank you so much, Dr. Nabia. Thank you so much, Dr. Gul. I think Professor Amna Yusuf is there from Lahore. Dr. Amna Yusuf, can you comment a few things? Dr. Amna Yusuf? Professor Amna Yusuf? Okay. There was one question from the audience, and you have also answered, where the human papilloma virus testing is there. I think all of the labs, Aga Khan, Shaukat Khanam, Chuktai, Noori, all other areas available in Pakistan which are doing the human papilloma virus. The one question, my question, that was asked from me when I was in Japan. I was doing research on human papilloma virus. Dr. Nabia, from you and Dr. Gol to you. It is claimed that human papilloma virus transmission route is sexual. Is it any other way? Because we did the research on the oral cancer, and we did the research from the bladder cancer, and the human papillomavirus was positive in both cancers. In Pakistan, it was a comparative study of 3 countries: Colombia, Pakistan, America, and Japan. And almost human papillomavirus was present all of the patients suffering these 2 cancers, other than the gynecological cancer.
Okay. Thank you, Professor Bukhari. I think the HPV sexual transmission is confirmed, and it can be urogenital sexual uh,
Oh, oh,
thing, which
this,
can lead
Yes.
to
yes,
the oral
this,
cancer. Yes.
yes, you have
And it
same
And
is said
question.
that
also,
circumcision in the Muslim community prevents HPV spread as well.
Yes, this was the answer from me, and then they asked the same the questions that you Muslim countries claim that there is no other way of, but there was no answer to me. I think this is the more very important thing, and I will request Professor Shafak and Department of Gynae in Kashmir that they should raise the voice and they should go in the colleges and in schools and girls' colleges because no doubt everybody has its own duty to do. If there are any questions, you are welcome to raise the hand. Any question? Dr. Shafak, over to you. And because my internet is not stable, yeah, you hold the session of
Professor
question answer.
Bukhari,
Thank you, Professor
Professor
Bukhari.
Bukhari, you said about the transmission. It's
Yes,
the
yes, yes, yes.
genital
You asked the question.
genital HPV variants. Although you've obviously you are a researcher and you've done more research on HPV than us, but it's the genital strains 16 and 18 that are sexually transmitted. But as Dr. Nabia said, that different sexual practices can lead to orogenital spread. Thank you very much.
It was thank you very much, Dr. Nabia and Dr. Gul. It was very nice talk and enlightened us. I will add. I would like to add something. Yesterday we had a short presentation by rather workshop by Dr. Bushra Khan, who is working as gynecological oncologist in Ahmedabad. She shared a very interesting thing that when the patients are referred for cervical cancer treatment to her, they keep with them big files showed to many gynecologists even, but nobody bothered to do even a Cusco speculum examination of the patient, and they go with vaginal complaints to the doctors, and doctors do ultrasounds and give them different prescriptions, and the patient go again to her home. And the message she gave yesterday was very interesting for me also, and I think we should ask our junior doctors and even medical officers who are working in different peripheral hospitals in BHUs and others, that if a woman comes with the vaginal complaints, whether bleeding or discharge, do her examine, do vaginal examination at the first instance. May something be picked up there in early stages.
Yes, Shafak, you are very right. And this is the most common finding, that once we see the patient who have been suffering for many years with irregular bleeding, with vaginal issues, and once we put the speculum, straight away you can find the pathology, whether it is a polyp, whether it is a malignancy, or any local lesion. Whenever a woman presents with vaginal system discharge and bleeding, it is the speculum examination is must.
Dr. Gul,
Dr.
you have
Shafak,
raised
a
the question.
very
Dr. Shafak,
yes,
Dr. Gul, you have raised the hand.
yes, Dr. Shafak, the most you brought up the most important thing, which I think I would be adding to my presentation from now onwards. That for surgeons, there's a saying that if you don't put a finger in the rectum, you have to put your foot into it. Same goes for the gynecologists. That I think it's very important that we should do it. We should examine all these women who come with some form of complaints, and examination investigations are there to complement our examinations, not the other way around. And we had forgotten, and we are doing investigations before we examine our patients. So a very valid point. Thank you very much for bringing it up.
Thank you very much. If there is no question, can we finish today's webinar?
I think
Okay,
Dr.
Dr. Gul.
Amna is here. Amna is here. Agar hum
Ji, Amna. Dr.
we
Amna,
can
you were saying something.
listen from
जी
Amna.
अस्सलाम
Dr. Amna, you
वालेकुम अस्सलाम वालेकुम it
Walaikum
was
Assalam.
thank you very much. Thank you very much, Mulazim Bukhari Saab. You have always brought in excellent topics. And this topic is very near to my heart because I have spent nearly 15 years trying to build up a system at King Edward's and Lady Wellington Hospital, especially, that we could do a good cervical cancer screening. But I feel that there is a lot of gap. And today, Madam has really pointed out some very important factors, which one of which is a national system for registration of all patients. Like we see that in the Western countries, they get their calls for their cancer screening. Over here, we don't have any such system. And let alone that, we don't even, our people are not even guided for that. So, yes, sir, you are very right. Talking to girls at school level, at college level, I have done that also. But then, the gaps are a lot, and we all need to put in an effort at a national level. I think all the conferences that we go through, like SOGP and etc., we should stress this, that a national registry system should start so that everybody is enrolled and we start working on it together. Thank you very much. And especially the vaccine also. Vaccine has also become a big challenge because now if somebody wants to get the vaccine, you have to get it imported from Dubai. There was a time when Cervarix was available. And I was asking all the medical students to get themselves vaccinated because I could ask the companies to get them at a lesser rate. But believe me, nobody got vaccinated. In the hospital, I got the company to bring in the vaccine at a lower cost, and we held a camp for 3 days. Only two people out of the 250 people serving at Willingdon got vaccinated. So, the situation is something that we still need that eye opener, that people should realize what a big challenge it is to deal with any cancer. So, this is the time. Thank you very much for this opportunity. And I have special prayers that, we should all get together and fight
Thank
this
you. Thank
problem
you.
back.
Thank you,
Thank you.
Professor Amna. Thank you, Professor Amna. You are always a good teacher, a good academician, a good surgeon. And Dr. Mosna, you have raised the question very excellent that there are big challenges even in the screening and other things. Let's have uh, make a team to fight this cancer. Today, I came to know that this is the second most cancer in the female after breast. And I have seen, so when I was in KE, I have seen so many measurable outcome of this cervical cancer. And thank you so much for everyone. Inshallah, we'll meet next time in news.
I think Nigat has raised hand. Nigat,
Yes,
you
madam.
want to add something?
Yes, madam.
Assalamu alaikum. Can you hear me?
Oh,
Yes.
yes, you are always there, madam.
Thank you very much. I just wanted to add that
You are regular attendee of our webinars.
जी बस मुझे अफसोस है पिछला मैं मिस कर गई.
हाँ वो
I
पिछला
would like to
stem cell
just
वाला miss
add
किया था.
just like to add one thing. Learned gynecologists who have been mashallah बहुत अच्छा इन्होंने सारा बताया. When you are going to schools to create awareness in anything, breast cancer, cervical cancer, kindly I would add that you must invite the mothers of those girls also.
Yes.
Because you see, when those girls go home, they
Good
may
question.
not be given importance. But when you make an awareness with the mother and daughter,
Dr.
it
Nikat, very
starts
good
creating
question.
waves.
Yes, very good point you have raised. Very good point.
Thank you, very nice seminar, and I would like कि
हमारा
आप
ख्याल ये है कि हमने अगर एक बच्ची को बता दिया ना इसका मतलब है
जी
we have
बिल्कुल.
covered one home.
सोशल मीडिया का सर बड़ा है ना इसमें रोल, वो भी तो है ना. अवेयरनेस उसके थ्रू भी तो छोटे-छोटे YouTube पे क्रिएट किए जा सकते हैं, लोगों में अवेयरनेस क्रिएट की जा सकती है.
हमने ब्रेस्ट कैंसर के लिए डोर टू डोर आई थिंक डॉक्टर मरियम बैठी हैं यहाँ पे. डोर टू डोर वी वेंट इन द कश्मीर एंड वी हमारा ख्याल ये था कि एक बच्ची कवर होती है ना तो उसका घर कवर होता है. नेक्स्ट टाइम इंशाल्लाह आई विल रिक्वेस्ट डॉक्टर शफक हनीफ head of the department of gynae to hold this walk or something awareness about it. And this campaign awareness is better than the prevention, awareness and better than वही बात है कि would you like to put a finger in the rectum or you foot in the rectum? That is very important. Thank you so much.
Yes,
Thank you.
sir.
Today we
Yes,
are
sir, you are very right. You are very right, sir. We have already started it. But these days were annual exam days of in most of the schools,
जी
so
मैडम,
we
इसके
couldn't go through it.
बाद भी क्योंकि ये कोई
Inshallah,
end day नहीं है. It
we
is
are
not
planning it
end
in
of the road. It is not end. It is a continuous journey.
inshallah. Sir, we are
Inshallah.
planning it in May and June, inshallah.
और मैं देख रहा हूँ कि
Okay.
आपके जितने भी लोग बैठे हैं ना, उनमें से सारे सब के सब जो है ना कॉन्शियस हैं. टॉपिक इज वेरी इंपॉर्टेंट. और उसके अंदर if there is no question, let me allow to finish today's webinar.
Ji, thank you very much.
Thank you very much. Thank you very much. Thank you very much.
Thank you all for listening. Thank you very much.
See you next time. See you next time.
Inshallah, inshallah.
Inshallah.